All right, I'm going to start by assessing my patient's head and neck, and I'm observing for symmetry of the facial muscles as well as the neck muscles. I'm going to palpate his temporomandibular joint for TMJ. Can you open your jaw for me and close it? Move it back and forth. Perfect. No popping or clicking or anything like that. I'm going to palpate the neck. You can look down for me. And I'm feeling the spinal processes. Is there any pain in your neck?
No.
All right. And can you try to touch your ear to either shoulder? And now shake your head like you're saying no. And nod like you're saying yes. Perfect. Push against my hand. Good. Push against my hand. Good. All right, I'm going to have you stand up. And I'm going to take a look at your spine. If you could turn this way. And go ahead and touch your toes, or as close as you can. And I'm looking for the basic alignment of the spine. It looks good. Any pain with bending forward?
Nope.
All right, and you can go ahead and stand up. And I'm now going to look at the spine from the side, making sure the curvature is correct. It's concave where it should be, and convex where it should be, and that looks fine. Any tenderness?
Nope.
Perfect. And the hips are equal height as well. And now I'm looking at the shoulders, which are nice and equal height. You push against my hands. Perfect. All right. And I'm just going to check the range of motion for this arm. If you could rotate your arm for me. Perfect. Whoop. And the other arm. Careful of the fan. Perfect. Okay, you can grab a seat for me. I'm going to look at the rest of his joints and his arms. His shoulders are fine. I don't feel any edema, no masses. Is there any tenderness?
No.
All right. I'll do the same with the elbows. It's fine. The wrists. Any tenderness?
No.
And I'm looking at the digits, the joints of the fingers. Good. And any tenderness on this side?
Nope.
All right. So if you could flex your arms up for me. All right. And back down. All right. Push against me. Good. And we're going to do it the opposite way. Push against me. Perfect. All right. You could rotate your wrists for me. Rotate them. Perfect. I didn't tell you to do anything yet. Push up against my hands. Not with your arms, with your wrists. So just like this. Perfect. And down. Good. On your fingers, could you make a fist? And then spread your fingers apart. All right, now I'm going to give you my 2 fingers. If you could squeeze my fingers as hard as you can with your hands. We are going to do 2 quick tests for carpal tunnel syndrome. If you could press the back of your wrists against each other. Do you feel any numbness or tingling?
No.
Perfect. All right. And then another test we're going to do is I'm going to go ahead and percuss your hand here. Or I'm sorry, your wrist. And just let me know if you feel any numbness or tingling.
Nope.
Anything? Perfect. And we would do that bilaterally as well. Now I'm going to check the range of motion of your hips, your knees, your ankles, and your feet, as well as checking for any edema or tenderness. Does anything hurt?
No.
All right. What about your knees?
No.
I'm just going to take your socks off so I can get a good look at your feet. Anything out of sorts with your ankles?
Nope.
And your feet? Perfect. All right. Can you go ahead and lift this leg for me? Good. And push down against my hands. All right. And push up. Perfect. We're going to do that on this side as well. Push up. And push down. And if you could lift that up as high as you can. Perfect. All right. For your ankles, can you push against my hands? Perfect. And good. Can you rotate your ankles for me in the opposite way? Perfect. Can you invert your feet and then evert? Perfect. And can you scrunch up your toes and spread them out? Perfect. The next thing we're going to do is we're going to start testing the cranial nerves. Cranial nerve 1 is the olfactory nerve, which is the sense of smell, which we had previously assessed and is intact on our patient. Cranial nerve 2 is visual acuity, which we would do with the Snellen chart, as well as the peripheral vision test, which is intact on this patient. We have previously assessed that. Cranial nerves 3, 4, and 6, we would assess by doing our accommodation, our pupillary response to light, the reciprocity of the reaction, and the fields of gaze as well, which we've previously assessed on this patient, and they are all intact. I'm going to check my patient's cranial nerve 5, which is facial sensation. If you could just close your eyes and tell me if you can feel me touching your face.
Yes. 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 Yes.
Perfect. All right. You can open your eyes. I'm now going to be testing my patient's cranial nerve 7, which is facial symmetry. Can you smile for me and frown and stick out your tongue and puff out your cheeks? Perfect. As you can see, facial features are symmetric. The movement is symmetrical. No issues there. For cranial nerve 8, that would be his sense of hearing as well as vibratory sensation through the air and through his bone, which would be the whisper test, the Rhine test, and the Weber test, which we've previously assessed on this patient, and they are all intact. For cranial nerves 9 and 10, I'm going to use my otoscope and take a look in my patient's mouth for movement of the soft palate, and we would also test the patient's gag reflex as well. Can you stick out your tongue and say, ah?
Ah.
Perfect. So that's very easily visualized. I saw the soft palate move. Cranial nerve 11 was the neck, or the strength of the neck and the shoulders, which we saw is intact. They move just fine and they have normal strength. For cranial nerve 12, we already had the patient stick out his tongue when we were testing his facial symmetry. So we were looking for any deviation from the tongue from midline. We were looking for any lumps or bumps, and everything came back fine. All right, I'm now going to watch you walk just normally to see how your balance is, your coordination, and you can turn around and walk back to where you were. Perfect. All right, I'm going to have you close your eyes, and you're just going to stand there. Perfect. You can open your eyes. Could you hold your arms out like this and close your eyes? Perfect. No drifting. There was a little bit of waving with the Romberg test. You can put your arms down, but nothing significant. You clearly didn't lose your balance, so that's great. If you could hop on one foot for me. Perfect. And if you could heel-toe walk for me, like they ask you to do for a sobriety test. I'm now going to ask you bring one foot to the opposite knee and drag it down the front of your leg. Perfect. All right. I'm now going to test your rapid alternating movement. You could do that. Perfect. All right. I'm now going to have you touch your finger to your nose and then to my finger, back and forth a few times. Can you do it with your eyes closed? And open? Good job. I'm now going to test your sensory perception and your periphery. I'm going to use this to demonstrate something that's soft. And this, the paper clip, is hard, okay? So I'm going to have you close your eyes and you're going to tell me if what you're feeling is soft or hard. Ready? Actually, I'll do it on the inside of your arm.
Soft. Hard. Soft. Soft. Hard. 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 Soft.
Perfect. All right. I'm now going to check your vibratory sensation and just tell me if you can feel this.
Yes. Yes. Yes.
I'm now going to put a small object in your hand with your eyes closed, and you just have to tell me what it is based on feeling. It's called stereognosis, okay?
A safety pin?
Yes. Excellent. All right. I'm now going to have you close your eyes, and I'm going to draw a figure on the palm of your hand, and you have to tell me what I'm drawing, okay?
Figure 8.
Yes. Excellent. I'm now going to test your 2-point discrimination. Just tell me if you're feeling 1 or 2 points. Okay?
Okay.
All right. Close your eyes.
2. 1. 2.
Mm-hmm.
1.
That was actually 2. I'm now going to test your reflexes. I'm going to start with your biceps reflex. So just give me all of the weight of your arm. Keep it nice and relaxed. Rest it on my arm. Perfect. All right. I'm now going to test your triceps. So same thing. Give me all the weight of your arm, okay? There we go. All right, so I'd say both of those reflexes are +2, which is right where they should be. Perfect. All right. I'd say that one is +2 as well. I'm now going to test your patellar reflex. Just do your best to let your legs dangle. I'm going to go right under the kneecap. Perfect. So that one is +2 as well. All right, I'm now going to test your Achilles tendon. Keep your foot at about... Perfect. Perfect. All right. I'm now going to test the Babinski reflex. So that's a negative Babinski, which is good. You do not want a positive Babinski once you're over the age of 2. I'm now going to test for ankle clonus. If you could flex, flex again. All right, now relax. Perfect. No clonus noted there.